My name is Destiny Wheeler, and today I'm going to be discussing the scientific controversy of alternative medicine for the Scientific Methods course. So a couple of key concepts of alternative medicine that I will be discussing is how it has various definitions and how the terminology differs between who you're talking to. I'll also discuss the history of alternative medicine and how it came about, some criticism it has, and how it can be applied to some of our key concepts from class, and the uses and regulations in certain types of alternative medicines. So whenever looking for the definition of alternative medicine, you'll find that it is hard to find a specific definition. So two main definitions that I found that tended to be the most related were the NCCIH defines complementary and alternative medicine as those healthcare practices not currently considered an integral part of conventional medicine. It covers a broad range of healing therapies, approaches, and systems. Now, however, there was also a descriptive definition that was by Ernst et al., and he wrote that it is a diagnosis, treatment, and or prevention which complements mainstream medicine by contributing to a common whole, satisfying a demand not yet met by orthodox or diversifying the conceptual framework of medicine. So, since there is a lack of consistency, they have tried to come up with some general categories that can divide CAMs into 5 different categories, and this is what we'll be discussing today. So, one thing I want to talk about that really related to our class is alternative medicine an anomaly? Considering that our textbook says an anomaly is such phenomena that can provide a way of testing the limits of our current understanding of how nature works and suggest a new and fruitful areas for scientific investigation, I do believe that alternative medicine is considered an anomaly, just because of the way that it has really tested the scientific community and testing if we can really back up what they are wanting to use as alternative medicine. So I'm going to give you a little bit of background history. Various alternative medicine approaches became very popular in the late 1800s. This reflected political trends at the time, which included the democratization of medical knowledge and identification with the Roman period of art and literature. It was within this time frame that everyone was really in love with nature, and so this is where the herbal supplements came about. In the early 1900s, it did lose its momentum and political attention due to scientific discoveries. However, they did reappear in a powerful force in the 1960s to 1970s. This arose as countercultural distrust of authority with the mainstream that infused the US during the Vietnam War era. Not only this, but the growing cost of healthcare is another main part of alternative medicine. In 1933, the first wide-scale survey in the US showed that 34% of US adults were using alternative medicine. So, why is it considered a controversy? Friedman concedes that alternative medicine relies enormously on the placebo effect, or the improvement to a patient's condition resulting not from the actual medication, but from the expectation of the given treatment. This comes from a lack of confidence within our traditional medical system, leading patients to not be as confident in or expect their treatment to work. He points out that between traditional and alternative approaches, alternative medicine definitely has the upper hand since the patients do believe more within the alternative medicine therapies. This brought me to look into the Hawthorne effect. We didn't really discuss this much in class, but when reading our book, I did notice how the Hawthorne effect is when an experimental subject's knowledge that he or she is taking part in an experiment can influence the subject's performance. This could easily be compared to the way people feel about alternative medicine, strictly because they don't want their other traditional medications to work. So they will fall towards wanting to use the alternative medicine. So, alternative medicine can be divided into 2 main types. There's the complementary and the alternative. Complementary is when it is used in addition to conventional medicine. However, alternative is when it is used instead of conventional medicine. Within these 2 types, there are multiple different ways to practice alternative medicine. However, I focus more on acupuncture, herbal medicines, and chiropractic. So acupuncture, what is it? Acupuncture is a technique in which practitioners stimulate specific points on the body, most often by inserting needles through the skin. One of the controversies with this that I found from the NCCIH is that current evidence suggests that many factors like expectation and belief that are unrelated to the acupuncture may play important roles in the beneficial effects of acupuncture. As our text states, this would be considered confirmation bias, which is a tendency to selectively focus on evidence that supports our beliefs while rejecting discomforting evidence. Almost all of the studies that have been done on alternative medicine show some sort of confirmational bias just because of the distrust within conventional medicine. We'll now talk about herbs. This is probably one of the most popular alternative medicines that people do on a regular basis, but the issue with herbs is that there's a lack of knowledge that people have when they're consuming the herbs. And this may react with another medication that they may be taking or any other just normal diseases or effects that they might have within their bodies. So herbal supplements, unlike prescription drugs, can be sold without being tested to prove if they are safe and effective. However, they must be made according to good manufacturing practices. However, practitioners often use herbs together because of the combination is more effective. Healthcare providers must take many factors into account when telling their patients to use the herbs. It is when the herbs are used with the practitioner's knowledge that these do have the most effective outcome because they are looking into many factors such as how they are stored, the plant's habitat, and the variety of plant. One thing that was surprising to me was the demand for herbal medicines has increased at such a rate that there are even master programs specifically for herbal medicines. Lastly, I'll be talking about chiropractics. An analysis of use of complementary health approaches for back pain based on data from 2002 found that chiropractic was by far the most commonly used therapy. Among those who had used chiropractic for back pain, 66% perceived great benefit from their treatment. Side effects from spinal manipulation can include temporary headaches, tiredness, or discomfort in parts of the body that were treated. So in conclusion, alternative medicine has been around since the beginning of the 1800s and looks like it will be continuing to remain within popular area in treatment. With alternative medicine, there are many positive aspects. With the herbs, practitioners even enjoy using the herbs in addition to their conventional medicine because it does have a positive impact. However, the controversies with it are whenever people have confirmation bias, and so we cannot have very accurate studies to know if they are actually increasing the benefits of alternative medicine. And here are my works cited. Thank you.